With a Supreme Court ruling on the Obama health care plan expected as soon as tomorrow, a new poll out tonight finds 61% oppose the individual mandate, while majorities support many specific provisions of the law. Another poll in Massachusetts, which has had a mandate for 6 years, finds 2/3 say they support the state's health care law. However, funding that plan remains a challenge.
Massachusetts, once again, is taking a giant leap forward.
Mitt Romney's mandate in Massachusetts that everyone acquire health insurance was signed only 9 months before he left office. So it's fallen to his successor, Democrat Deval Patrick, to implement the law.
I was skeptical of it when I first heard about it. But the basic insurance idea that you get everybody in and you spread the risk widely so you keep the costs down for everybody, very, very smart.
Yet since the reform, overall health spending has risen from 36% to 43% of the state budget. And Massachusetts spends more per person on health care than any other state. The notion that this is a budget buster, you think, is a mistaken one.
You know what's a budget buster is increasing health care costs. And that's not about access, that's about a phenomenon in our economy.
Insurance premiums in Massachusetts have increased from an average of $331 a month in 2006 to $401 in 2010. Employers foot the bill for more than 3/4 of Massachusetts residents, but most of the new coverage has come through publicly funded programs. The state subsidizes some residents to buy insurance from one of 8 providers. Mary Flynn needed the help. After leaving her corporate job to start her own public relations business, she lost her health insurance.
I was totally scared. I didn't know what I was going to do.
Flynn, who has chronic asthma, found that her lower income made her eligible for a plan that now costs her nothing.
The mandate wasn't even a consideration for me. What was a consideration for me was that I was 61 years old. I needed health insurance.
Are you finding you're getting back to patients faster?
With more people insured, Dr. Samava Stout has seen a surge of new patients and paid bills. She helps oversee primary care for the Cambridge Health Alliance.
The days of scrounging around to find medicines for someone who can't afford them or find a fancy way to get somebody to a specialist by begging and pleading, those days are gone.
Please take a deep breath.
Stout believes health costs will come down as the newly insured seek more preventive care. Already more people are getting cancer screenings, more women prenatal care.
You have people who before would get their diabetic care in the emergency room who instead are coming in to primary care, not ending up hospitalized every 3 or every 4 months.
When we did health care reform, they put the question of cost control off to another day, and we're tackling that right now.
To fight rising costs, Governor Patrick has empowered the state's insurance commissioner to reject excessive insurance premium increases like the double-digit hikes of recent years.